Okay, let's go. Two sides of a street, right? Where do you live? Which side of the street do you live on? Look over there. Let's meet somebody who lives on the street, though. I don't want to go left or right. So let's meet Alex. Top right corner, is that OxyContin in your spoon? Hey, Alex, your grocery store sells gas. Bottom right, you can get a deal on your 60-day medication supply if you don't have an address. This is Sherlock Holmes. Do not theorize before you have data. So let me take you into the medical model. Medical model, then I will translate it to the social model. So in the medical model, we do a lot of data analytics. How do we do that? Because we have standard definitions. So we are dreaming about standard definitions for the social determinants. So here's Mr. Johnson, right? Goes to the Minnesota State Fair, has a blood test. Because we have standard definitions for diabetes, we know he has screened positive. He can be referred to the doctor or the nurse. Bingo, we have the diagnosis, and the medical machinery of quality improvement can go into effect. Can we do that for social determinants? We dreamed we could. This is the story of that dream, okay? So, because you're all here, we know that social determinants are more impactful for community health. So I don't think it's an apple to oranges comparison between medical and social. I think it's apple to spaceship. Do we have money? Do we have money? Yeah, we have a lot of money in the medical. We have a lot of money in the social. Like Commissioner Ellinger said, what about a community, accountable community for health, where those two money streams join? So that's what we did. Some brave folks in this room got on the boat, data analytics phase 2, check it out, Google it, got on the boat, nursing home, clinic, hospital, government, private, me, and rode northwards. So this is number 1. Say it with me. 1. Number 1, food insecurity. Same standardized screening question. This is a public health nurse or a community county social worker. This is a hospital intake nurse or social worker or a nursing home nurse or social worker. Same standardized question, right? What about if the patient is in the physician's office or the nurse practitioner's office? Same standardized question. One standardized question, then we can build a pathway to triage after you screen. Once you screen positive, then you refer on to the right person to diagnose and treat, like we do for diabetes. Can we do the same thing for number 1, food insecurity? I think we can. I think we can. So let's build those pathways, and then let's not forget monitoring. Once you've created a plan for the food insecurity, then somebody's got to monitor it. Just like diabetes, just like heart failure, just like hypertension, we can do it. So that's our dream. Say it with me. Number 2. What is that? Housing instability, right? Think about that. That's some of us. Could be some of us. Which side of the street do you live on, Paul? The other side. Yep. Number 3. Say it with me. Come on. Number 3. Transportation. I know medical systems, healthcare systems, counties, community health is always trying to find out why there's that no-show. Say it with me. Number 4. So we said once you're open to a social service agency, that's the social determinant we need to have on the list. So that's a county public health nurse or a county social worker. Say it with me, please. Number 5. That's mental behavioral health. We talk a lot about childhood trauma. I want to give a tip of the hat to Emily Piper, Dr. Jeff Schiff, and others. A lot of work happening in mental behavioral health. Number 6, the final one. So no list, prioritized list for social determinants is complete without race, ethnicity, and language. So that's our list. That is our list. And so we said, here's our list. Now, do we have the collective courage to get off our butts. And don't let this report gather dust on the World Wide Web. Let's do something about it, Minnesota. Join the journey. Thank you.